My name is Rob Merkel. I'm the Global Engagement Leader within IBM Watson Health, and I'm based in the New York area, but I support clients around the world. Well, first, I think it's very important that we start off with both the challenge and the opportunity in healthcare, which is the proliferation of information that's generated every day. If you think about medical literature, it increases substantially on a daily basis. I used to say that medical literature doubles every 5 years based upon the statistics. Then I saw statistics every 3 years. Now they say by 2020, medical literature will double within every 2 months. And there's no person that can read that much information. We say it's beyond human cognition. But herein lies the opportunity. If you can tap into all of this knowledge that's being generated on a daily basis, you can provide much needed assistance to clinicians who do not have a significant amount of time based upon all of the demands that they have on them, as well as provide better care for patients with supporting evidence on why they should pursue certain treatments. So cognitive computing does just that. Cognitive computing is a new era of computing that's fundamentally different than traditional computer programming techniques. It actually can read through these large bodies of information, understand what's in it, and help create models with organizations that enhance and scale expertise. So within the realm of healthcare, imagine a clinician having a collective intelligence or a partnership with a cognitive computing engine that can help provide insights against these large information sources at exactly the right time a clinician needs it to apply it to care. So Watson's role in healthcare is to essentially, as I said, enhance and scale human expertise. So within healthcare, that's all about assisting clinicians and making physicians and nurses and other specialists' jobs easier by helping to provide insights into large bodies of information. Specifically within oncology, there is a significant amount of new literature between research and medical literature that's created on a daily basis. Clinicians, oncologists, physicians do not have the time to read that much information. What Watson for Oncology does is it has endless capacity, can read all of that information in and apply it in novel ways so that physicians can better understand patient circumstances in a consistent patient summary, and that they can then apply or consider treatment options for those patients based upon all of the medical literature that it's been trained on. So we're very excited about the announcement with Manipal Hospitals today, and I think there's really a few dimensions to it. One is it's the first client where we're bringing cognitive computing into India. Second of all, it's focused on healthcare, and really what that's aimed at is assisting clinicians in providing much needed knowledge at exactly when they need it to assist in treating cancer patients within India. The challenges broadly that we face in healthcare is if you look across the globe, the status of technology in healthcare varies considerably. So one thing's for certain, we're seeing a massive digitization of healthcare information across the globe, but everybody's in different starting places and everybody's on separate paths to improve over time. Once that information is in a digital format, Watson can read it, and then Watson can provide much needed insights against that information, which is highly transformative to the industry. But for organizations that are in more of a foundational state, a more rudimentary approach has to be taken. Now also, one of the benefits of Watson, given this disparity of capability, is it can read. It can actually understand unstructured data sources, we refer to it. So imagine text, not a database, but just text about an individual. Watson can read all of that information and understand what's in it, as opposed to looking for a structured database or something that you might find out of a traditional electronic medical record. We have very ambitious plans within Watson Health. It's the first time within IBM's history that we've established a vertical industry within the corporation, and that's a testament to what we believe the opportunity is, as well as the level of investment that we're making in healthcare. So we're looking at providing a whole range of capabilities that help assist clinicians, help assist patients, help assist in use cases such as medical education. So we're looking very, very broadly at healthcare because we believe cognitive computing can drive such tremendous value into the industry. Well, it's interesting because the science is expanding rapidly. And so I think what's going to happen is we're going to continue to see an acceleration in literature, in scientific research, and what cognitive computing is going to do is help leverage that information to assist in treating patient care. So I see an acceleration of this capability, and what it's going to help do is ensure that clinicians have access to the latest research.